demonstrating your first, your steps through which you go through this, or each one of this is important. Your sperm preparation, your embryo transfer, embryo culture, the incubation, the pregnancy, whatever, each of these things are most important for the success of your IVF, and each of these are essential steps. So here is very important, you should have good gonadotropins. Again, people will ask that what makes a successful IVF? You need to use good quality medications. You need to have a good ultrasound and good knowledge of an ultrasound medicine. You need to have a good lab where sperms can be retrieved and prepared. Then you need to have incubators and such sort of instruments where, the incubation can take place. Culture media very important. Your transfer technique is important. So all of it together results in our desired outcome or pregnancy. That is where the secret of this IVF lies. Nowadays, what is the status of IVF? Now, so many years, earlier when IVF began, people used to think that it is experimental. But as of now, it is one of the most common treatments for infertility. Success rate again depends on a number of factors. Age of the female partner being one of the most important. Then there are other things like indications for the procedure, and the list goes on and on. But then the truth is that a lot of babies have been born in the world as a result of IVF treatment, and now the children who are born out of treatment initially have started to give birth to their own children. So I think the cycle is complete. Before IVF proper, there was a few tried out treatments like this Gamete Intra-Fallopian transfer. These sort of things you'll always read in your textbooks. You should know that this sort of procedures are there, but then they are again technology intensive and extensively skill based. By and large, nowadays it has been replaced by IVF and ICSI. Okay, so what is ICSI then? Again, I've come to ICSI. ICSI is another very important breakthrough in reproductive medicine, very important assisted reproductive technology, because here came hope for patients with, your azoospermia. It was an accidental delivery by Van Streitigem et al. In 1992, which, they found that, the direct injection of a sperm can be done into an egg and then bypassing all the other barriers, and this could result in pregnancy. That's called intracytoplasmic sperm injection, and it has given so much hope to lot, especially for male factor infertility. Is very revolutionary. You have these patients with severe male factor infertility, so many disorders you can see: cryptozoospermia, your globozoospermia, then your azoospermia, both obstructive as well as non-obstructive. So it's basically male factor infertility and also for non-male factor infertility. In fact, if you have a reality check in most of the IVF centers where assisted reproductive technology is done, you will find that ICSI has by and large overtaken your IVF as in sheer terms of procedures done. You never cease to be amazed by this miraculous procedure. It's just showing a sperm that has been taken off, and then the way you can inject it into an egg, and the way and how it becomes in a pregnancy. I think you would have seen it over and over and over again, but this miraculous procedure never ceases to, you never seem to get tired of it. And if you're in a lab watching this procedure, you will never cease to be amazed by it. The next day you find the pronucleus, and then you are so amazed at the way in which technology has evolved. What happens is that when you have achieved such technology, that you tend to believe that you have achieved the status of a god in the lab, but it never happens. There's a success rate following all these procedures, and you have to be very realistic about it. And then when you see cumulative statistics, you should never see success rates in one particular batch or in one particular group of patients that you've done. Over the entire year, when you go and analyze the success rates, you find that it will come to around 24, between around 30% it will be a success rate. And then and there's a difference between a success rate of treatment even after the patient becomes pregnant. The same patient has got she could abort, or she could have a preterm delivery. So there will be a different type of a take home baby or a live birth rates. These two things are different, ultimately between 20, but over the years it's improving. But we must remember that there are limitations, and then it's not a procedure where all your patients would get pregnant. So the next question every patient desires to know is that what are the basic requirements to become successful? Because when a patient comes to a doctor for treatment, the patient expects 100% success rate. Patient wants to walk out with a baby. So on the side of the clinician, we have to do certain things like you have to counsel the patient well. Patient needs to be informed about what chances of pregnancy are, and for that your clinical history, examination, investigation is very important, and then you end up at your counseling. You can counsel only on the basis of all the above factors. So this is very important, and why you should identify the cause for infertility, you should identify the adverse factors, and then you should choose the right protocols. And there are different determinants of success in IVF. The age of the patient, like I said, is very important, and a lot of things which determine whether the procedure becomes successful or not. So it's a combination of all this and your counseling that ultimately gives the result to the patient. So your aim in IVF is to get adequate number of good oocytes. So you should be able to predict that, and the prediction is not once your stimulation has started. Your prediction should be before you start stimulation. Then how do you do that? The age of the patient will give you an idea. The anti-Mullerian hormone will give you an idea. The antral follicle count will give you an idea. These are all indicators for the number of eggs that you're likely to get out of the patient. You should remember that the number of eggs you get, more number of eggs that you get, you hyperstimulate the ovaries to get more eggs. So the more number of eggs you get, the more number of euploid embryos you're likely to get. The more euploid embryos you're likely to get, the more your chances and likelihood of pregnancy. So your selection of stimulation protocol is very important, that what you choose, and that again is individualized depending on, varying on patient to patient. So this is very important, and I think we summarized in this particular slide that IVF success, again like I was mentioning earlier, if you remember about your IUI, it's like a jigsaw puzzle. You have to fix in pieces of the puzzle, and then ultimately it looks beautiful. If you get your one part of the puzzle wrong, then the picture is never complete. So your ovulation induction is important, your technique of oocyte retrieval is important, your lab quality is important, what you do, your IVF for ICSI, it makes a difference, and then your selection of the best embryo is vital, number of embryos transferred, and your embryo transfer technique. Each one of these plays a very, very, very important role in your success of your assisted reproductive program, without mentioning luteal support. Now, over the years, since the last say 15 to 20 years, there's a big change that has occurred in vitro fertilization, and that is because of the development of technology called cryopreservation. Now, cryopreservation is a real game changer. You can freeze everything now. Discovery of cryoprotectants without damaging the gametes. That's very important, without damaging the gametes, like, your DMSO, just remember the name, and propylene glycol. Now, these have really been game changers, because these have come now. You can cryopreserve sperms, you can cryopreserve embryos, oocytes, testicular tissue, ovarian tissue, say what. You can cryopreserve sperm. For example, if the man is going to have some kind of chemotherapy or radiotherapy, his sperm can be cryopreserved and then, subsequently used. Embryo cryopreservation is a boon. Patients who have ovarian hyperstimulation, the incidence of ovarian hyperstimulation has decreased so much because you don't transfer in the same month, and it's all owes it to cryopreservation. Oocyte cryopreservation, even in young unmarried girls now, this social freezing of oocytes has become quite common, and because of that they can pursue with their careers, they can cryopreserve their oocytes. Similarly, testicular tissue and ovarian tissue. So the success of IVF and the development owes much to cryopreservation. So see, all few indications are detailed in this slide. Supernumerary embryos, if you have many embryos, there are many instances where patients have one child, they cryopreserve their embryos, and the same set of embryos are transferred after 4 or 5 years, and then the patient can have a child again from those embryos. Similarly, I was mentioning our ovarian hyperstimulation, and then there are few situations in IVF. Sometimes you have very thick endometrium, sometimes you have very thin endometrium, sometimes you have polyps, then you really wish that, what could I do? I don't want to transfer the embryos. You can cryopreserve them and then transfer them in the subsequent cycles. Similarly, I was mentioning about, oocyte cryopreservation. That was supposed to be the most difficult of all these cryopreservations. But now, since 1990s, the pregnancy numbers have increased. Similarly, ovarian tissue banking. Ovarian tissue banking is also now done, and abroad and in many centers in India, it's now done also as a matter of routine. Now, this is the one, there are always people who are the first. Now, this is a picture of a baby resting in the arms of the mother. The mother has beaten the cancer and given birth after an ovarian tissue transplant. That is tremendous. It's not cryopreserving the gametes. This is the cryopreservation of ovarian tissues. So I think that is very, it's groundbreaking or path breaking, this cryopreservation. always, we are searching for being the best, ultimate. What is the ultimate is, thing that a ART specialist or wants, desires, or he wants to find the best sperm to transfer, he wants to find the best embryo, and he wants to transfer an embryo which is genetically normal, or otherwise called an euploid embryo.